This is Dr. Jonathan Lebowitz at Lebowitz Plastic Surgery, located in Huntington, Long Island, New York. Today we just completed on this gentleman right here regular liposuction with gland removal. As you can see, this is the liposuction we did. This is a liter out. It's already separated the fat and the serum that came out of here, and that's exactly actually 1 liter, 1,000 cc's. Now, very interesting is the gland. He had one side bigger than the left side, bigger than the other side. One side bigger than the other side. I think actually the left side was bigger than the right side. But as you can see, this is all gland. There's really no fat here. I sculpted and whittled this down, and as you can see, you cannot liposuction this. This is like incredibly hard and fibrous, almost like a chicken cutlet on there. And that's the left side. It was a little bit bigger than the right, and this is the right side, again, fibrous and hard. So I believe closure is very, very important. I've got teenagers and kids, 13, 14, and 15, that, and even younger, 12-year-olds, that are ridiculed and bullied because they have gynecomastia, otherwise known as female-like breasts. And when they get older, you know, they're conscious about it, going to the gym, wearing, you know, light-colored shirts, especially in hot weather, and they're tormented by this. Bullying when they're younger, and you know, social intimacy when they're older, and they just want this out, and you got to get this out. This is, nobody wants this. Really, look at this thing. Nobody wants this in here. So I believe that closure is very, very important. So I'm labeling this Gynecomastia Gland in hand, because I'm going to get this gland and I'm going to put it in the patient's hand. Gynecomastia Gland in hand. Kind of cute. And I'm going to have them kind of cut that. And you're going to, right in front of the thing, just kind of take scissors here. It's like a scissor. Go for it. And just kind of cut. Don't cut your finger off. No. And just kind of cut right through, and you can see, go for it. See how fibrous this is. You see that? And that's like, look at that thing. That's the, yeah, and of course you can't liposuction this out. So yeah, show them the thing that you can't just kind of cut that. I mean, you can't liposuction that. That needs to be cut out, and that's underneath the nipple. So if you kind of see the nipple and see kind of, this is kind of like not a great thing, but you kind of, if this is the skin, and that leaves the puffiness of the nipple on there, kind of the puffiness. And so we liposuction, sculpted around his chest, underneath his underarm, got that beautiful hockey stick boomerang shape to his pectoralis major muscle, laterally to the latissimus dorsi muscle, if you know anything about anatomy, and really kind of whittled away at this gland. And then we make a little incision just about from the 4 o'clock to the 7 o'clock position on his nipple. It's already been dissected from the liposuction, and really pop this sucker out. And it's gone, and it's a relief. When you saw that out, it was like...
Absolutely.
Absolutely. And again, this side is the smaller side, but it's the same. You can hear it, maybe. It's just hard and rubbery, and you know, and no guy should have this. They should feel confident and see their posture. You're going to notice that your posture is going to be, better. You know, get your chest out, stomach in, and be real great. So this is why closure is so important, and this is why I'm calling this Gynecomastia Gland in hand, and they can feel it, and cute, and they can feel it, and it's closure. It really is just kind of, just get rid of it, throw it out, burn it, put it on the fire, and just get rid of it. And that's it. We did it on the local in my office. Very comfortable. It was
very comfortable.
Yeah,
very comfortable.
No pain, just great. And this is the liposuction we did. Sometimes we do not need the liposuction, but all males have gland. All males have gland. All males need the gland to be removed. And liposuction is an added on that if they want a little bit of sculpting of the and contouring of the chest. About 50% of people I do just the gland, and 50% I do with the liposuction, and a little bit more with laser smart liposuction if they need kind of shrinkage and tightening of the skin. This is Dr. Jonathan Lebowitz at Lebowitz Plastic Surgery. We're located in Huntington, Long Island, New York. Just completed a case of liposuction and direct gynecomastia gland removal. If you have any questions about gynecomastia, please call my office located in Huntington, Long Island, New York. 631-424-0101. That's 631-424-0101.